Most men don't realize that the penis also ages, just like the heart, brain, or bones. If ignored, not only can its function be lost, but also confidence, dignity, and the bond with oneself. Hello, I am Dr. José Martínez. I am a urologist and professor of medicine with over 30 years of experience in men's health. I have specialized in helping older men maintain not only their sexual function, but also their identity and self-esteem. And if I told you that the most frequent cause of penile dysfunction in men over 60 is not directly related to age, but to the daily care we do or do not give to our health, and that it is not necessary to resort to medications to make a difference. In this video, I share with you 5 essential practices for penile care, backed by science and especially designed for men over 60. These are not tricks or magical solutions, they are concrete, practical, and accessible strategies that can protect your intimate health and significantly improve your quality of life. Stay until the end because I will share an additional tip that most doctors do not mention, but which can prevent one of the most painful disorders we frequently see in older men. Before we start, if you haven't already, I invite you to subscribe to the Salud de la Tercera Edad channel and activate the bell so you don't miss any useful advice tailored to each stage of your life. 1. Maintain sexual activity, even without complete sexual relations. There is a widespread misconception that sexual life ends after the age of 60. Not only is this incorrect, but it can also be harmful from a physiological point of view. The penis needs to stay active like any other part of the body to maintain its health. Research published in the American Journal of Urology showed that men who had sexual relations less than once a week doubled the risk of suffering from erectile dysfunction compared to those who maintained a frequency of once a week or more. This finding highlights the importance of maintaining an active and constant sex life, especially as we age. An erection is not simply a mechanical response, it is a complex vascular process. Each time an erection occurs, oxygen-rich blood flows strongly into the cavernous bodies, which are 2 spongy structures inside the penis. This oxygenation is essential to nourish the tissue, preserve its elasticity, and keep it functional. If this process is not repeated regularly, local hypoxia can occur, meaning a lack of oxygen in the tissue that over time generates fibrosis, an abnormal accumulation of collagen that hardens the tissue and reduces its expansion capacity. This condition is known as penile atrophy due to disuse. Even spontaneous erections that occur during sleep, known as nocturnal erections, play a fundamental role. Under normal conditions, a healthy man can experience between 3 and 5 of these erections per night, each lasting between 25 and 35 minutes. It is a natural maintenance mechanism that protects the functional integrity of the organ. However, certain health problems such as sleep apnea can reduce the frequency of these erections, which in turn negatively impacts penile health. Maintaining an active sex life, whether through intimate contact with a partner or through self-stimulation, is not just a matter of pleasure, it is also a form of preservation. By promoting frequent blood flow to this part of the body, the good condition of the tissues is promoted. An adequate supply of oxygen is ensured, and their functionality is preserved in the long term. Now that you understand why it is so important to maintain this regular sexual activity, allow me to talk to you about another equally essential aspect, one that all men usually believe they control until one day they realize they have neglected it for too long. Let's talk about hygiene. 2. Maintaining adequate intimate hygiene may seem obvious, but after more than 30 years of treating men in consultation, I can assure you that hygienic care of the penis is one of the most essential and at the same time most forgotten forms of self-care, especially as the years go by. I have seen many men arrive with infections, irritations, and even more serious conditions simply because no one taught them how to clean themselves correctly. The problem is not the lack of cleaning, but not understanding how aging modifies our body and how our care habits should be adjusted. As we age, the skin becomes more sensitive, the immune system responds more slowly, and the body takes longer to heal irritations or fight bacteria. This means that what we once considered sufficient at 30 or 40 years old is no longer enough. If you have not undergone circumcision, hygiene requires even more attention. Under the foreskin, sweat, skin debris, and bacteria can accumulate, creating an environment conducive to infections such as balanitis and even increasing the risk of penile cancer. Yes, you heard right, cancer, and it is not something rare. For example, Brazil has one of the highest rates of penile cancer in the world, and the main cause is poor hygiene. This risk does not decrease with age. On the contrary, it increases. The solution, however, is simple. Wash carefully using warm water and a mild, fragrance-free soap without aggressive chemical agents. If you have a foreskin, gently retract the skin and rinse well. Most importantly, dry the area completely. Residual moisture creates an ideal environment for bacteria and fungi to proliferate, especially in the skin folds. Always clean after sexual intercourse. Bodily fluids, lubricants, or even sweat and natural sebum can alter the balance of beneficial microorganisms on the skin. This routine takes no more than a minute but can prevent uncomfortable infections, unpleasant odors, and in some cases, major complications. The area under the foreskin is warm and humid, a perfect environment for the development of fungi and bacteria. The accumulation of smegma, a substance composed of dead cells and fat, can cause chronic inflammation of the glands, known as balanitis. This continued inflammation can alter the cellular structure of the tissue and increase the risk of precancerous lesions that in certain cases lead to squamous cell carcinoma. That is why it is essential to use appropriate products. Mild, fragrance-free soaps are the most recommended, as aggressive products can eliminate the protective bacterial flora and damage the skin's natural barrier, thus facilitating the growth of harmful microbes. Drying completely after washing is a step that many men overlook, but how essential is it? Excess moisture creates the ideal environment for the Candida albicans fungus to develop, causing fungal infections, something especially common in men with diabetes due to increased sugar in the urine. What surprises many men the most is the emotional change that accompanies this habit. When you care for your intimate area with the same attention as you care for your mouth, your heart, or your image, you start to feel different, cleaner, more secure, more in control of yourself. And that is something powerful, especially in a world that often invites older men to disconnect from their own bodies. But hygiene is just the beginning. There is a problem that almost no one talks about, which is rarely mentioned in time and can cause serious damage. It all starts during an intimate moment when you are not fully prepared. It's time to talk about a silent risk that many ignore until it's too late. 3. Avoid having sexual relations when the penis is partially erect. This may surprise you, but I have treated too many men in consultation who have suffered intimate injuries simply because they did not know the risks of starting a sexual relationship without a complete erection. In the heat of passion, when desire dominates, this detail seems insignificant, but forcing penetration with a partial erection can cause damage that accumulates over time, and its consequences can mark a before and after in your intimate life. Let me clarify. The penis is not a simple skin tube. It is a delicate structure formed by blood vessels, spongy tissue, and smooth muscle. If it has not reached its total rigidity, it does not have the necessary resistance to withstand physical effort. Therefore, forcing it in that state can cause what in medicine we call microtraumas. These are tiny internal injuries that do not always cause immediate pain, but over time form scar tissue beneath the surface. This scar can harden, tighten the surrounding tissues, and cause a condition known as Peyronie's disease. If you have never heard of it, Peyronie's disease is an abnormal curvature of the penis during erection that can generate pain and, in severe cases, make sexual intercourse difficult or completely impossible. The American Urological Association defines it as a disorder caused by the appearance of fibrosis plaques under the skin of the penis. These plaques cause the tissue to lose its natural elasticity and become deformed. The American Urological Association also notes that one of the most common factors causing this condition is repeated microtraumas during sexual intercourse. And it is not just about penile fractures, which, although serious, are rare. The real risk lies in these silent, small injuries that accumulate without giving signs. Many men do not realize until the curvature is so evident that the erection begins to be painful or ineffective. At that point, conservative treatment options are greatly reduced. That is why using a quality lubricant is a simple measure that can significantly reduce friction and effort during the act, thus decreasing the risk of injury. A good lubricant minimizes rubbing, facilitates penetration, and protects the internal structure of the penis. In my consultation, I have had this conversation with many older men. Most arrive late, embarrassed, without having previously talked about the changes they notice in their bodies, and all without exception regret not having known before. If you are using medications or devices to facilitate erection, give them their time. Let them act completely before continuing. This simple precaution can save you years of discomfort, frustration, and unnecessary treatments. It is not weakness, it is knowledge. And having knowledge is having power over your body, your health, and your intimate well being. Now that you know how to protect yourself physically in moments of intimacy, it is time to address a topic that not only affects the body but also directly impacts the mind. Let's talk about one of the biggest silent dangers that exist for desire and emotional connection in maturity. Let's talk about the unexpected impact of excessive pornography consumption. 4. Limit pornography consumption. I want to speak to you sincerely from man to man. We live in an era where access to adult content is easier than ever, and for many older men, especially those who are alone, widowed, or feel disconnected, resorting to this type of stimulus may seem like a harmless way to keep desire alive. But after years of working with thousands of patients, I can tell you the following. What initially is an occasional escape route can become, without you noticing, a substitute for something much deeper and human. And this silent change can distance you from the real connection you deserve. The reality is that excessive pornography consumption modifies the way the brain responds to pleasure. It accustoms the mind to a specific type of stimulus, fast, visual, and individual. Over time, this can cause a kind of emotional desensitization. Real intimacy with its pauses, nuances, and imperfections no longer produces the same effect. I have heard men in their 60s and 70s tell me that they still feel desire, but when they are with their partner, their body no longer responds as before, and they believe there is something wrong with them. However, in many cases, it is not a physical problem, but a psychological deregulation caused by prolonged exposure to this type of content. Additionally, the frequent and solitary use of pornography can generate feelings of shame, isolation, and low self-esteem. It becomes a private habit that replaces human contact, and this undermines security, self-worth, and the ability to relate emotionally. At ages where we already face hormonal, social, and emotional changes, this becomes a difficult burden to bear. Neuroimaging studies, such as those conducted with functional magnetic resonance imaging, have revealed that excessive pornography consumption can alter the structure and functioning of the brain. A study by the Max Planck Institute in Berlin found a relationship between the number of hours watching pornography and a reduction in gray matter volume in the striatum, a brain region related to the reward system and motivation. The consequences are not limited to erectile function. They also affect satisfaction in the partner relationship. Continuous exposure to unreal sexual scripts can generate unrealistic expectations about sex, the other's body, or one's own performance. This can lead to performance anxiety and, in many cases, deteriorate the emotional intimacy that is the basis of any lasting relationship. I am not here to judge or criticize. It is not about pointing fingers, but about inviting you to moderation. If you decide to consume this type of content, do so sporadically and consciously. But above all, I encourage you to reconnect with your own paths of natural excitement, memory, fantasy, emotional closeness. This can mean taking more time for foreplay, having an open conversation with your partner, or simply allowing yourself to feel without pressure or expectations. And since we are talking about harmony, there is a final piece in this puzzle. A foundation that not only supports sexual health but also your vital energy. It is what fuels your confidence, your performance, and your ability to fully enjoy life. Let's talk about lifestyle. 5. Prioritize your lifestyle over medications. If there is one truth I have learned after decades of treating men over 60, it is this. Your way of life has more impact on your sexual health than any medical prescription. Many of my patients come looking for a miracle pill, a quick solution to regain what they believe they have lost. But the reality is that no medication can compete with the power of healthy habits maintained over time. Your lifestyle is the engine that drives everything, from blood flow to hormonal levels to mental clarity. And yes, it also affects your ability to function and feel like yourself. The Massachusetts Male Aging Study, one of the most extensive and long-lasting studies on men's health, clearly demonstrated that factors such as smoking, obesity, and a sedentary lifestyle are some of the main predictors of erectile dysfunction. Another study published in the Journal of the American Medical Association, JAMA, revealed that modifying lifestyle by losing weight and exercising regularly improved erectile function in approximately one-third of obese men suffering from dysfunction. The connection between lifestyle and sexual health is not an anecdote, it is a biological fact. Erection depends on good blood flow, and blood flow is directly linked to the health of the heart and blood vessels. Smoking, excessive drinking, or having an unbalanced diet damages these vessels and reduces circulation to the most important parts of your body, including the penis. In fact, erectile dysfunction can be one of the first warnings the body gives when something is wrong with the cardiovascular system. It is an early alarm signal. The good news is that every healthy decision you make today has immediate and long-term effects. Quitting smoking improves circulation within days. Reducing alcohol consumption helps balance testosterone levels. Walking at least 30 minutes a day, eating foods that benefit vascular health such as berries, leafy green vegetables, or blue fish, not only lengthens your life but also fills it with energy. You regain vitality, strengthen your confidence, and little by little your body starts to respond again. What excites me the most is seeing a man realize that his body is not broken. It is waiting for you to pay attention to it again, to care for it as it has cared for you for so many years. I have seen patients completely change their lives by transforming their daily habits. They sleep better, smile more, regain their bond with their partner and with life itself, and stop depending on drugs because they have built something more solid, a real foundation. So before thinking about another medical prescription, put on your sneakers and go for a walk. Choose water instead of whiskey. Give importance to rest. Surround yourself with people you can talk to, laugh with, and share with. Your body not only listens to what you give it, but also to how you live. And now there is one last piece of advice I want to give you. It is simple, but powerful. Most men have never heard of it. It happens while you sleep and could be the missing key to protecting your intimate health as you age. Let's talk about something unexpected. What you wear or don't wear when you go to bed. Sleeping without underwear may seem like an unimportant detail, almost too simple to pay attention to. But after many years of accompanying men in the care of their intimate health, I have learned that the most discreet habits often have the most surprising effects. Sleeping without underwear is one of them, and when you understand why, it completely changes your way of thinking about rest and long-term well-being. In addition to allowing nocturnal erections to occur without restrictions, which helps prevent problems such as Peyronie's disease, sleeping without underwear has another key benefit: temperature regulation. The testicles must be kept at a slightly lower temperature than the body to ensure correct sperm production. Wearing tight underwear at night can raise scrotal temperature, which negatively affects seminal quality. Although fertility may no longer be a priority for many men over 60, the health of the endocrine system in general is. A lower temperature can also favor better testosterone production, which is especially stimulated during sleep. Opting to sleep naked or with loose pants allows the body to recover naturally without unnecessary compression or friction. It may seem like a minimal change, but I have seen how it has made a significant difference in men who sought to feel more comfortable, more functional, and more secure in themselves. And if you wonder, can something so simple really be so important? I invite you to observe how all these recommendations intertwine, because when you start applying them together, something powerful happens. In this final message, I want to show you how these 5 essential steps, along with this last additional habit, can help you recover something even more valuable than sexual health. Let's talk about dignity, confidence, and the true meaning of aging your way. What we have shared today, keeping the penis active, caring for intimate hygiene, protecting yourself during intimacy, limiting artificial stimulation, adopting a healthy lifestyle, and yes, even sleeping without underwear, are not just medical advice. They are everyday acts that reflect self-respect. Each gesture reinforces your dignity, your energy, and your connection with who you truly are. I have had the privilege of accompanying many men in the process of reconnecting with their bodies. They did not do it out of nostalgia or to pursue youth. They did it because they chose to take care of themselves, to stay present, and to value sexual health as an expression of their overall health. And if you are at that moment where you doubt in silence or do not know where to start, I want you to know that you are not alone. Thank you for being here, for listening, and for choosing to invest in yourself. You have already taken the first steps. Let's continue this journey together. If this message has resonated with you or you believe it can help someone you love, your brother, your father, your best friend, do not hesitate to share it. Like, subscribe to Salud de la Tercera Edad and join us in more real conversations about men's health in their best stage. It is never too late to start. Stay strong, take care of yourself, and live with the confidence of someone who knows they deserve to feel good.